as we know, the UK, they're looking at a new plan, a proposed law, to raise the legal age of buying cigarettes year on year. So, for example, someone who's 14 now would never be able to buy tobacco or cigarettes legally in their entire life. Now, as the listener pointed out earlier, that doesn't mean people won't smoke, because people will go and get them on the streets, as we know to be true, with many different things, including cannabis. But I want to chat to an expert in the field, a specialist in tobacco treatment, Dr. Colin Mendelsohn, who joins us live. Good morning, Doctor. How are you?
Good morning, Isaac. Thank you.
Should Australia follow suit?
Look, I think there's some merit to this plan. In theory, it's a good idea. We don't want kids to smoke. We know it's addictive. We know it's deadly, and we don't want them to start. But look, to be frank, I think this is a low priority for tobacco control. Like in the UK, there's only 1% or now less of kids 11 to 15 are regular smokers. That means they smoke at least one cigarette a week. So it's really only a very small target audience. Kids are giving up smoking in their droves. And the problem we have, certainly in Australia, is that kids are not taking up smoking, which is good, but the adults aren't quitting. That's the problem. And it's the over 40-year-olds who are addicted, who need help, who aren't stopping and who are dying and getting lung cancer and heart and lung disease because of it.
I mean, one of the points that one of our listeners mentioned earlier today is that people who want to smoke and won't want to give up will just go to the streets or underground to get tobacco. Do you agree with that sentiment, especially adults who are already smoking?
Absolutely. Look, we know prohibition doesn't work. Bans almost never work. 25% of the Australian tobacco market is provided by criminal gangs illegally. And so it's very easy to get illegal tobacco. And if you tell kids not to smoke, guess what they're going to do?
Smoke.
And there'll be plenty of black market outlets happy to sell them, illegal products. So I think in theory it's a great idea, but it's not proven. I mean, it hasn't been shown to work anywhere in the world. They're starting it in New Zealand in a couple of years. It's not actually been proven to be effective, and I think they're going to find there'll be a lot of resistance about, personal choice, personal, rights, liberty, and I think that there's going to be a big pushback by kids being told not to do something that they want to do.
I don't want to be cynical, but is there actually a solution to this problem?
Well, I think the solution to the problem that we have in Australia, and the problem is that people over 40 are not quitting smoking, so the levels are flat and have been for several years. The most effective quitting aid we have is vaping, and that's been shown to work in many other countries to rapidly bring down smoking rates, to help people who have struggled to quit with repeated failures in the past. It works for many people who otherwise can't, and that would have a much more substantial effect on public health. And I think that's what we should be spending our time on. In Australia, we're the only country in the world to put huge barriers, the only Western country to put huge barriers up against vaping for all sorts of funny reasons. Whereas in countries like the UK and New Zealand, the smoking rates are plummeting as a result of it.
So I'm assuming from that you're pretty anti the laws coming into play when it comes to vaping. Do you think they should be scrapped? And how do we, I guess, mitigate against excessive vaping use?
Yeah, look, I think what we've seen is that the current laws don't work. This idea that you have to get a prescription to get nicotine, go to the doctor, find the pharmacist, it just isn't working. We warned the health minister some years ago this was going to fail, and it did. And I think doubling down on that same model is going to just lead to more failure. It's just a disaster. What we should be doing is what they're doing in other Western countries, which is to make vapes available as legal adult consumer products from licensed outlets with strict age verification. So if you're a smoker, you can go into a retail licensed outlet and say, I want a vape to help you quit, and you can buy it without having to jump through all the hoops. Kids, well, of course, some of them will get around the laws. It's not going to be perfect, but there will be restrictions on access to kids. Look, the other thing is, we don't want kids vaping either. Kids shouldn't smoke or vape. But to be quite frank, vaping has only a tiny fraction of the risk of smoking. And what we're seeing in other countries is that where kids are taking up vaping, smoking rates are plummeting even faster. So there are benefits even. We don't want kids to do either, but if they're going to do one or the other, we'd much rather they vaped.
Do you think there's enough information and enough evidence out there that the government can look at to actually support that in regards to vaping?
Absolutely. There is more than enough evidence. The debate is not about the scientific evidence. The debate is, it's now political, it's ideological, it's about vested interests, it's about money, it's all those things. I mean, if you look at the evidence, it's very clear-cut. Vaping, we know, is the most effective quitting aid available. We know it's only a tiny fraction of the risk of smoking. We know there's no evidence of it being a gateway to smoking for kids. In fact, it's just the opposite. And it's bringing down smoking rates in other countries faster than ever. But it's politically difficult to deal with. And there are people who say, well, people shouldn't be using nicotine because that's an addictive drug.
Yes.
So there's always resistance to it, whereas in fact it's a huge opportunity for public health.
And let me ask you this. How many people are coming to your practice with the hope of stopping smoking? And are people's attitudes changing towards smoking? Or, as you say, it's flatlining in adults, but in young people, it's decreasing?
It is decreasing. I mean, in young people in the 14 to 17-year age group in Australia, in our last national survey, it was 3% were regarded as current smokers. In the UK, it's 1%. Yes. So, look, it's very small, and it is declining. And in the UK, it's declining faster because of vaping. So kids are taking up vaping instead of smoking, kids who would have smoked. And, look, to be honest, that's a good thing for public health, although we'd rather they don't do either.
Yes.
It's a good thing. But, I mean, we're very conscious that smoking is just the worst thing you can do for your health. But, unfortunately, people start when they're young, they make silly decisions, and then they're stuck for life. And we need to offer them practical and effective strategies to help them quit. And in Australia, we've taken our eye off the ball and our smoking rates are going nowhere. We need to really step up and address this because it's the biggest preventable cause of death in Australia, even still, after all these years.
I think young people understand how unattractive smoking actually is, Doctor.
Yeah, they do. Look, it's disgusting. And I think if you have a choice between a blueberry-flavoured vape that doesn't make you stink and that tastes nice and looks cool, or buying a packet of Stinkies, which are absolutely, prohibitive from a financial point of view, and which make you smell and which make you cough and are disgusting, it's pretty obvious why people are favouring vaping. But, the fact is that nicotine's been around for thousands of years in society. People want to use nicotine, and we just want them to use it in a way that's less harmful, that will do them less damage. Smoking is the worst way of getting nicotine. Vaping is much less harmful.
Doctor, thank you very much for your time today. We really appreciate it.
My pleasure. Thanks, Art.